Welcome to the BDI Empowers podcast, where experts simplify disability benefits so you don't waste years figuring them out. Now, get empowered.
Good morning, everyone. I'm Anna Mackey. I'm the Director of Program Services here at BDI. So the topic we're focused on today really comes under our heading of benefits navigation, because we do want to help individuals navigate not only the process of acquisition, but the maintenance of those benefits, particularly when there's transitions. So I've been with BDI now for 10 years, and the Benefits Nav program is still going strong. So thank you for having me this morning. All right, so what do we want to talk about today? Our core issue here is addressing that very specific transition from an individual who has had SSI, who is now transitioning into SSDI as a DAC, as a disabled adult child, and what that process looks like for maintaining Medicaid. But within that, I need to provide a contextual backdrop. So I want to take a big step back and talk about what the different types and classifications of Medicaid are, because once you see that there's two fundamental kinds of Medicaid and there's multiple classifications of Medicaid, it will help you kind of pinpoint this is where we are and this is what we're trying to get to, and where those variables can come into play. So we want to talk about different types and classifications of Medicaid and what limitations there may be for eligibility as it relates to income limits, because there are multiple classifications of Medicaid and therefore multiple income limits. For the most part, the resource limits are holding the same at or around 2,000, but I do want to spend just a little bit of time talking about some of those income limits. And then we want to jump right into focusing on that transition process, particularly as it relates to SSI to SSDI as a DAC. Now, we will have some individuals who begin with SSI, they're earning, and then they have earned sufficient work credits to make them eligible for SSDI on their own work record. That's not what we're talking about today so much as we are about maintaining Medicaid for SSI and then as a dependent adult child. So I just want to clarify that piece. All right, so let's talk about the big contextual backdrop of government benefits. So individuals with disabilities generally need three things in order to be as independent as possible within the community. They need some form of income, some form of health insurance, and some level of services. Well, the income predominantly is through Social Security benefits. And in most instances, your traditional case is an individual who's turning 18, they've never worked, they're not eligible as a dependent adult child because the parents are still alive, the parents have not retired, the parents are not disabled, so they're applying for SSI. So this is, I would say, about 85% of our cases fall under this category. And so when they're applying for SSI and they're awarded, SSI in Georgia has automatic enrollment with Medicaid. So it's critical to note that because there's that automatic enrollment, there's not a separate Medicaid application for SSI. When you're transitioning, that changes. Okay, so let's look at SSI. Starting with SSI, you get the approval, you're automatically enrolled in Medicaid, and Social Security is your agency that's addressing any of your issues related to Medicaid. So let's say we have a situation where the individual has 18, they apply for SSI, they're awarded, they never had Medicaid before, and they know, because we've had sessions like this, that Medicaid comes with it. They never get their Medicaid card. Who do they call? They call Social Security Administration, because this is SSI, straight Medicaid. It's tied to their Social Security benefits. Okay. So SSI is generally the kickoff point for benefits for individuals. Then there's Social Security disability insurance. Well, Social Security disability insurance is It is. It's insurance. You've earned work credits, and if you become disabled, then you're able to apply for Social Security benefits and get your benefit from there. In most cases, with the individuals that we're working with, they're starting with SSI, and then they're transitioning to SSDI, not on their own work record, but on their parents' work record. And what that looks like is the parent has to trigger eligibility for that SSDI as a dependent adult child by sadly passing away, because then you have survivor benefits, happily and more commonly through retirement. So the parent retires, they take the application, they invite the individual to apply for SSDI. And then also if the parent becomes disabled and taps into their disability benefits, that again opens the door for a dependent adult child to receive benefits. So SSI and SSDI are the two forms of Social Security benefits, SSI being the needs-based program, SSDI being the entitlement program that's based on work credits. Medicaid, automatic enrollment with SSI. Medicare comes with SSDI following a 24-month waiting period. And then there's services. So the services that we focus on include Medicaid waivers. And so Medicaid waivers like the Now Comp waiver, independent care waiver, community care services waiver, elderly disabled waiver, all of those waivers are funded through Medicaid. So Medicaid dollars are very critical for the longevity of these programs. So ideally, an individual, when they turn 18, classic case again is they're applying for SSI, they're awarded, they have Medicaid, and they're probably receiving family support services because as an 18-year-old, they probably haven't gotten the Now Comp waiver yet. Let's fast forward several years. So now let's say they're 30 years old. So 30 years old, maybe they've worked some, but not enough to have work credits on their own right, eligible for SSDI, but the parent retires. So at that point, when the parent retires and the parent is completing their application for retirement, then the individual is invited to apply, because you have to apply for SSDI. Even though you've gone through the whole process as SSI, you still got to apply. At that point, they would have the SSDI, and then that's when that 24-month waiting period would begin for Medicare. And this is the crux that we want to talk about today of how do you make sure that you continue to maintain access to Medicaid if you're no longer receiving SSI. All right, let's have a global look at Medicaid. So fundamentally, there's two types of Medicaid. And you'll see this when you get into Gateway and kind of get mired down into Gateway sometimes. The two types of Medicaid are low income Medicaid and then ABD Medicaid. So I know there's a lot of alphabet soup here. ABD Medicaid is age, blind, or disabled Medicaid. So just think about it, fundamentally, two different types of Medicaid. One that's based on income. And this is, you see a lot of programs related to, pregnant women and infants and things like that. So low income Medicaid and then ABD Medicaid. Even within that, there are multiple classifications of types of Medicaid. So let's focus in just on the ABD Medicaid. So under ABD Medicaid would include your straight Medicaid through the deeming waiver, which otherwise known as Katie Beckett. You would also see SSI straight Medicaid. And again, the SSI straight Medicaid is tied to when you have that SSI award. 1619B Medicaid. So 1619B Medicaid is when an individual starts with SSI and they have Medicaid through SSI and they work to a level where they hit that break-even threshold such that they're no longer receiving SSI income, but they're still able to receive Medicaid under 1619B. So that's 1619B Medicaid. And then there's DAC Medicaid. So this is the one that we really want to hone in on today. dependent adult child Medicaid. So this is the category of Medicaid that's intended. The legislative intent is that if you have an adult disabled child, that individual should always have access to Medicaid, right? So they begin traditionally with SSI straight Medicaid. Then when the parent retires, and because the individual is receiving up to 50% of the parent's earnings, that is usually too much for SSI. It might eclipse that SSI award, at which time they lose access to SSI. And when they lose access to SSI, they lose access to SSI straight Medicaid. So DAC Medicaid is intended to be that classification of Medicaid for individuals who formerly had SSI straight Medicaid, are no longer eligible for SSI straight Medicaid because they lost SSI due to having increased funds from SSDI. And so now they have DAC Medicaid. So that's what we're going to focus on today. There's also waiver-based classifications, and we use the waiver-based classification sometimes as a safety net when things go sideways, but there's a risk to that. We have had some individuals who are like, well, I'm covered because we have the, now classification of Medicaid as our primary classification of Medicaid, and, the waiver's going strong, everything's fine. Okay, but there's a risk to a cost share when you have a waiver-based classification. So if your primary classification is now comp and not DAC, you could actually get a bill later on going, okay, this is your out-of-pocket payment requirements to maintain this. And so we don't want any cost share. So our preferred primary classification in those situations is DAC Medicaid. There's also a classification of Medicaid whose express purpose is to pay for Medicare premiums. That's QMB Medicaid. So, and I've added this about QMB only and QMB plus. I know this is all kind of confusing. And just to add another layer of confusion, DFACS has codes for these classifications. So you can be talking to DFACS and they'll talk about Q1. Well, you have Q1. What the heck is Q1? Q1 is their code for QMB, or they'll call it QMB only. If you have QMB and another classification of full Medicaid, again, let's say QMB plus DAC Medicaid, right? They're going to call that Q2 or QMB plus. So I'm just throwing this out there, not to confuse you, but to alert you that there are these other codes and acronyms that just honestly just kind of muddies the water. So if you just recognize that QMB can also be referred to as QMB only or Q1, and that if you have QMB and full Medicaid, that folks at DFACS are going to say that you have QMB plus. And it's just confusing because you're like, I never saw anything that said QMB plus. What the heck are they talking about? That's what they're talking about. So I mentioned that there's Medicaid income limits. So the Medicaid income limits vary based on what type of Medicaid do you have. So for SSI, you can't exceed the amount of the award. Usually, this gets a little wonky now, okay? And sometimes you see inconsistencies with that. When you're applying for SSI, first, if you're earning over substantial gainful activity, that 1690 level, you're not going to get approved. But historically, if you're exceeding the award of like 994, then you also run the risk of not getting approved. After you're approved, the SSI calculation is roughly half of your earnings that get deducted. So this is why you want a benefits counselor to help you calculate what that might look like. But in general, with SSI, you should not exceed the amount of the award in order to maintain your SSI. Makes sense, right? If you have 1619B in Georgia, you can earn $41,927 and still be eligible for that classification of Medicaid. If you have a waiver, then the limit that they're looking at is called the 300% of income rule. And for 2026, that amount is $29.82. So see how muddled this can be. You need to know what type of Medicaid you have. You need to know what those income limits are so you can balance and manage that accordingly. And this is why the benefits navigators at BDI have a full-time job. It's because we're trying to keep up with all of these changing tables and make sure that the appropriate table is being applied. And sometimes what happens is DFACS makes mistakes, and we've had situations in which they should have used the 300% of income rule, and instead they were using the Medicaid limit for low income. Yes, that's $29.82 is monthly. And when we're talking about earnings, we're talking about gross earnings. So $29.82 monthly. And when you're talking about Medicaid income, to get to that $29.82, it's the totality of countable earned plus countable unearned income. And what I mean by that is, let's say if you have an individual who's earning $1,000 gross monthly, okay, so they got $1,000 in countable earned, but then they're receiving SSDI as a dependent adult child, and let's say that was $1,800. Okay, so $1,800 is countable unearned income because that's from SSDI, plus the $1,000 countable earned brings you up to $2,800. So you're kind of close to that 300% of income rule. So you always add your countable earned plus your countable unearned to determine your Medicaid income limit. That's the core rule. Earned plus unearned equals Medicaid limit. The resource limit is pretty universal. So I went through this just yesterday, in fact, with the Medicaid renewal. Typically, when you're doing Medicaid renewal, what you need to show are your bank statements, usually for the last 3 months. And what they're wanting to check is what's the beginning balance, what's the ending balance of any accounts that you have. If you are on Medicaid, truly, you should not have a savings account. You can use an ABLE account in lieu of or instead of a savings account. But if you're doing Medicaid renewals and you have a savings account and a checking account, then you're going to have to show all of those bank statements for the past 3 to 5 months to show that you never exceeded that resource limit. And honestly, this is one of the most common reasons that we have SSI overpayment situations with Social Security is because when they do their audits, and they're going to do the audit at the end of the month, they're focused on what is your end balance. If your end balance was $2,010, then they're going to request that you send back that SSI income for that month. Any month that you're over the resource limit, you owe Social Security back because you're no longer eligible for SSI for those months because you've exceeded the resource limits. So that's just something to always be mindful of. If you have SSI, it's tied to Medicaid, you always maintain that resource limit of 2,000. When you have DAC, Medicaid, and you're doing your annual renewal, expect to upload those statements from your bank. All right, let's focus a bit about transitions. And I mentioned other types of transitions here as well. One of the common ones we get is a transition from Katie Beckett to SSI. So we have individuals who, because their parents earn more than what's allowable for SSI eligibility, they applied for a deeming waiver, which also known as Katie Beckett, which provides access to Medicaid for individuals not including the parent's income. So they're not looking at the parent's income so much as they're just looking at the degree of severity of the individual's disabling condition to see if they warrant access to Medicaid for therapies, hospitals, et cetera. So that's Katie Beckett. So Katie Beckett is going to end when you turn 18. Now, typically what they will do is when you apply for SSI is you take a copy of your application for SSI and you give that application back to the Katie Beckett office. And I always encourage folks who are on Katie Beckett to apply within a 30-day window of that 18th birthday. So you turn 18 on May 21st, then the first week of June, you want to apply for SSI, apply online, print a copy of that application, send that to the Katie Beckett office, and they're going to extend your access to Medicaid as a transitional Medicaid for that period of time. Usually at least up until age 19. I've had some cases because SSI is taking longer to get approved, where they've extended it a bit past that. But they're not going to be able to extend that unless they have a copy of the SSI application showing that that's what you're doing. So that's Katie Beckett. Let's talk about the SSI to SSDI scenario. So this is the one where when an individual is an adult dependent child and the parent is now retiring, that we want to move from SSI to SSDI on that parent's record. And we want to make sure that we're applying for Medicaid at the same time. Here's the big takeaway from today. Okay. If you had a highlighter, this would be the part that you would highlight. We've always known that you need to apply for SSDI benefits as a DAC. It's not an automatic process. Used to, you didn't have to go through adjudication again, but now it's a complete new process. Let's say dad retires, dad's going to complete his retirement application. They should ask, do you have an adult dependent child? And they say, well, yes, I do. And his name is da, da, da. And they double check everything. And then at that point, they're like, okay, we can take an application for SSDI as a DAC. You cannot apply for DAC online. It's something that they have to do. There's no place for the track. We've tried that to go, like, this is what this is. Yeah, it's not going to work. So they really want you to apply for SSDI benefits either in person or over the phone. But what also used to happen is there used to be more of a seamless transition from SSI Medicaid to SSDI Medicaid. Even as recently as 4 years ago, it was pretty seamless. What I'm seeing now is you have to apply for DAC Medicaid with an application. Yes, DAC is dependent adult child or disabled adult child. So that requires a separate application. So it's confusing for the families because they're doing all this with Social Security, right? So they got all that going. And then they lose their SSI Medicaid. And then they're like, wait, what happened to Medicaid? I got to get that reinstated. And it's like, well, it's not really a reinstatement because it's a different classification of Medicaid. It's DAC Medicaid. So we need a DAC Medicaid application. All right, let's talk about DAC, SSDI, and DAC Medicaid. So again, Social Security has their DAC program, disabled adult child, dependent adult child. I kind of use that interchangeably. So DAC references either disabled or dependent. And what this program allows is for adult children to receive the disability benefits based on the parent's earning record. So it's if both parents were to retire at the same time, then they're going to choose the higher parent's record. If one parent retires first and they're using that, and then let's say a couple of years down the line, the other parent retires and that parent's income was higher, then they're going to process that under the higher earner. But the way that works is a DAC would be eligible for up to 50% of the earning parent's record. And the reason I say up to 50% is because we see a lot of scenarios with some families having multiple dependents. Sometimes, let's say one of the parents was not an earner. And so that parent is also receiving like spousal benefits off of the earning parent's record. So that can impact the child's benefit. I had one family, they had triplets. And so that's 3 individuals. So, it's going to be dependent on the family dynamic, and the family maximum credit is 188% of that earning parents record. So it's Social Security math. They're going to calculate that to determine what that appropriate benefit would be. But generally, it's up to 50% of that parent's record. So what is a disabled dependent adult child? For purposes of Social Security, and the reason I say that, and I want to underscore that, this is just for Social Security. IRS has a different definition. Other organizations have different definitions. If you're talking about extending your loved one on your insurance past 26, that's a different definition. So for purposes of Social Security, this is what a DAC is. A DAC is an individual who's 18 or older, is unmarried, has a documented disability that began prior to age 22. They have to go through the adjudication process and meet that determination of disability criteria and standard. In other words, they have to go through that process and be approved, be awarded. And the DAC has never earned over substantial gainful activity limits. Okay, so let's back up on, kind of break this down a little bit. The unmarried part. One of the interesting things about DAC is if an individual has been determined a DAC, then what happens later does not have an impact. Okay. So I've had situations in which the individual was unmarried, went through the process, parents retired, now they're a DAC, getting that higher amount, and then the individual gets married. But they don't retro that piece. In other words, even the fact that they're married now, they once determined DAC, they're continuing as a DAC. So I'm not saying they can never get married. I'm just saying if they are married prior to that determination of DAC, they're not going to be viewed as a DAC. Same thing with earning over substantial gainful activity. And this is one of the points that I love to focus on as a public service announcement, because a lot of this information you just don't hear other places. And what this means is let's say your loved one has SSI and, now they're graduated from school. Maybe they went to post-secondary inclusion and they're doing great and they've got a job and they're earning work credits and they're earning and they're earning and they're earning. If they have a pattern whereby they are earning over substantial gainful activity, and then you're applying to establish them as a dependent adult child, that application will likely get denied because they're looking like, but he's able to work over substantial gainful activity. He's been doing it. He's not a DAC. Yeah, he needed SSI, but now not so much. So be mindful of working anytime. If you're a Social Security beneficiary, you always want a benefits counselor to guide you through that process, not just for how is this impacting me now, but how could this impact future benefits, right? So any individual, let's say is 20 years old, parents are not retired and they're earning, if they're on a trajectory for now comp, if they're on a trajectory where we don't think that they're going to be able to sustain working at, a high level, and there's a good potential payout under the parent's record, we might want to purposefully stay below that substantial gainful activity rate. Okay. Now, once they have gone through that process and they're determined a DAC, and they work over substantial gainful activity, they're following those SSDI rules where if they are over SGA, their benefit is suspended, but they're not automatically precluded. Okay. So this gets a little muddy. And that's why just understanding that these are like the core rules, and then working with the benefits counselor to apply those rules to your situation. So very important. All right, more on DAC eligibility. So to be eligible for DAC Medicaid, you first must be determined a dependent adult child through Social Security. In other words, you have to go through that medical determination. So step one is getting the SSDI benefit. Step two is continuing Medicaid. So look at it as a two-step process. So the way that process begins is again, that trigger from the parent. Parent retires, they complete the application. Do you have a loved one? Yes. They link the files. They complete the application for retirement for the parent, and they set up a phone interview to take an application for the DAC. That's usually the most common process. So first one for the retiree, and then an application for the DAC. If you are retiring and you're going through that process and they're doing the interview and they don't ask, do you have an adult dependent child? They're supposed to. If you don't ask, then you need to initiate that process. Okay. So just make sure, be alert that when you're retiring and you're completing that process and you have an adult dependent child, that by the end of that conversation, Social Security knows of the presence of this adult dependent child, and hopefully you can schedule that phone interview for that individual. But that's what's going to trigger the process. I've had individuals try to apply as a SSDI, and I'm like, the parent's not retired yet. Got to wait. So there has to be a trigger. So that trigger is A, death and survivor's benefits, B, retirement, or C, the parent becomes disabled. All right, what is the substantial gainful activity limit? That's 1,890. So let's say that individual is a DAC and they're earning, they cannot earn over, any Social Security beneficiary cannot earn over substantial gainful activity. That's the threshold with Social Security. If you have substantial gainful activity, means if you're able to work at this level, you're not disabled, regardless of the nature of your disability. That's why that is so important to be aware of substantial gainful activity. Like if you have a pattern of working at substantial gainful activity level, unless something has significantly changed, they're going to assume that you're able to continue working. All right, so there you go. DAC SSDI process. Somebody retires. I like the retirement. Much happier than survivor benefits, but there has to be that trigger. So once you have the trigger, then that opens the door for the DAC SSDI process. All right, so let's talk about that application process. So once the earning parent has applied for retirement, ta-da, that's the trigger. The door opens for the DAC to apply. So it does require a separate application, which then means it's going to require a separate adjudication. That DAC application is not available online. So generally, you will want to set a phone appointment or an in-person appointment to apply for those benefits. In most cases, if the retirement application is being taken and the intake representative understands that there's a DAC, most times that intake representative will go ahead and set up another phone interview. They're not going to do it all together because they kind of budget their time and they're like, okay, this application should take 45 minutes and then I have another application to take in 45 minutes. So they're usually not going to do it at the same time, but they should set up another phone interview. You will need to provide a birth certificate and the parent's Social Security number to begin that application to prove DAC status. So sometimes I am in situations where the families are estranged and there's a concern that the other parent is not going to be willing to have the individual as a DAC off of their work record. They don't get a choice. This is an entitlement program. So the earner does not have to approve having their child receive benefits. Okay. So this is an entitlement program, but you do have to show that that's their kid. So that's where that birth certificate is coming into play. How does this relate to step kids? So stepchildren are treated as children. And so you would show the marriage certificate. So birth certificate, if it's a natural biological parent, marriage certificate, if it's a stepchild. For biological children, once they are SSDI beneficiaries off of the parent's record, that's ongoing. If it's a step parent and they are subsequently divorced, then that stepchild loses access to SSDI on the step parent's record. So just be aware of that as well. Okay. So once you've gone through the adjudication process again, and this is messy. Okay. I'm just going to say this part's messy. So let's assume, okay, the individual has always had SSI. And then let's say the parent retires in January and they do the parent's application and they're like, okay, yeah, we got a DAC. Let's schedule the interview. And they do that still in January, let's say. Then they have to go through the adjudication process. That could take months, depending. Remember when you applied for SSI, some cases, some conditions, you got Down syndrome, we're going to do that in 30, 60 days. We got autism, that's going to be a year, probably. That's what's going to happen again. So, and this is where it gets muddy, because throughout that year, while they're waiting, so let's say it's January is when they applied, and let's say it's December, before they're awarded. So you have, the whole year, that individual has been receiving SSI. So the question becomes, once they're determined eligible for SSDI, that retros back to January, right? So that's a big chunk of money. The question is Social Security doing the math, or are you going to be doing the math? And so what I want to emphasize there is watch this process closely, because the way the math should work is whatever the SSDI award is, the SSI should be subtracted from that. That's the amount that is the eligible benefit. So if you have a situation where they've been getting SSI for that full year, and then they give you like the lump sum, they don't do the math, then they're going to turn around and like the next week, practically, they're going to send you an overpayment letter. Okay. So there is that significant risk of overpayment just because Social Security hasn't done the math as it relates to that award process. So again, be mindful of that. The award's going to retro back to the point of eligibility. This is where, again, I really encourage y'all to use our benefits consultation, use our WIPA counselors so that we can manage all of this appropriately and watch this carefully. The individual is eligible for Medicare after a 24-month waiting period. So let's, in that same scenario, they're awarded SSDI, in December after having applied the January before. They only have like a year left to be eligible for Medicare. Again, the DAC award is going to be up to 50% of the parent's award. Most times the SSDI award is higher than the SSI award. Not always, because sometimes we have situations where, the parent was not a high earner or paid into an alternate system, like into some form of pension where their Social Security benefit is lower. But in most cases, that SSDI award is higher than the SSI award, and the individual is then ineligible for SSI. So again, we do want to be mindful of that overpayment situation. All right, let's look at the transitioning to DAC Medicaid part. The DAC Medicaid is tricky in Georgia because the policy is not very well written. I'm quite firm that the legislative intent was for all individuals who are dependent adult children to have access to Medicaid. However, in practice, the way the policy is written, an individual must have SSI to be eligible for DAC Medicaid. But what that means is if you, let's say the classic case is an individual, let's use my sister as an example. We lost my dad when she was 13. So she received survivor benefits. She's not disabled, but if she had been disabled, then at the point when she turned 18 or exited the school system, she would have to be deemed disabled, but she would not be eligible for DAC Medicaid because she never had SSI. She only ever had SSDI. So in those kinds of cases, we want to look to see what other form of Medicaid can we use to fill that gap. All right, so from there, at that point, when you have lost SSI, this is when you have to apply for DAC Medicaid. So it's a dual application process. You must apply for DAC SSDI, And you must then apply for DAC Medicaid. It's not automatic. So you would complete a Medicaid application. You can go to Gateway and do it on Gateway, or you can, send in an application. I encourage you to upload the following documents. You're going to need to show that you had SSI. So you want that SSI award letter, and you want to show that they now have SSDI as an SSDI beneficiary. So they want documentation for both. You had SSI, now you have SSDI. When you get that SSDI letter, they do the math in the letter. So they show that, this is the wage earner, it'll have the name of the wage earner as part of the letter. And anybody can see that, okay, this is from that award. You will also need to show bank statements. And I generally encourage 3 to 5 months, not just the last bank statement, but 3 to 5 months, showing that you have been maintaining that below 2,000 eligibility part. It's especially critical for renewal. If you've never had Medicaid before, again, they may not necessarily need the 5 months. Individuals are often eligible for more than one classification of Medicaid, especially if the individual has a waiver. So if the individual has a waiver, even if they've lost SSI straight Medicaid, but they're now eligible as a DAC, they could also have dual eligibility for Medicaid under now comp. You can also be dually eligible for Medicare and Medicaid. And we ran into a situation just yesterday with DFACS. And the person said, well, we're denying your DAC Medicaid because you have Medicare. And you're like, no, it doesn't work that way. It is very common to be dually eligible for both Medicare and Medicaid. So we're working through that process, and they're getting their supervisor involved, and we're going to fix it. But Jiminy Crickets, yes, you can have Medicare and Medicaid in case most individuals do. In fact, there is a marvelous Medicare dual needs plan for individuals with special needs through Medicare. So when you get to that, I'm like, I can't wait to get my mitts on that plan. So like my son, he has SSI, private health insurance, Medicaid secondary with the SSI. But when I retire, then again, after that 24 months, that would open the door for Medicare for him. Then that would be the plan that we would be looking at. So he would no longer have private health insurance. He would have Medicare as his primary insurance and Medicaid as his secondary insurance. So that's usually the common model. So again, if they're eligible for DAC Medicaid, that's the best classification. DAC Medicaid is full Medicaid. Now comp does have a cost share risk. When things go sideways, I shouldn't say if, I should say when things go sideways, a lot of times the Medicaid status, the Medicaid loss happens because people didn't know that they needed to apply for DAC Medicaid. Because I swear, like used to, it was automatic, and now it's just not. Be aware that timing is wonky because of them waiting for you to lose SSI before they can process the DAC Medicaid application. There's a 3-month retro period though. So you got 90 days. So let's play this out. Worst case scenario, your loved one has a waiver. They're going to a day program. So you got all those costs. They had SSI, Medicaid, and then they've lost that, but they haven't finished processing the DAC Medicaid. And you're like, you can still, your day program should allow you to continue because they can retro the billing for 3 months. So it should be okay. But this is something that anytime you're in this situation, you want to monitor very, very closely. Anytime that you're working with DFACS, get the name of the person that you're talking to and always know what your case ID number is. That way, if we need to escalate it, we can track it. Okay. It's really hard for me if I'm dealing with the deputy administrator or whomever. If I don't have a case ID, it's kind of like trying to find a needle in a haystack. So having that case ID is so, so important. There is an ABD chain of command. So when things go sideways, reach out to us. We can help connect you to the right people. So remember to protect Medicaid. Don't go over that 2,000 resource limit. You can always have supplemental needs trusts or able accounts to offset that. All right. I hope this has been helpful for y'all. I would certainly invite you to set up a consultation so we can look at it individualized and make sure that your unique situation is addressed, because it's hard to take all these general rules and then apply them to all these different scenarios. So having opportunity just to cross-reference everything would be good. Thank you.
This was BDI Empowers, your guide to independent living. Join us again next month to learn more about simplifying disability benefits.